Can men get tested for HPV? Have you ever wondered if men can get tested for human papillomavirus? The answer is yes, but it is not as straightforward as it might seem. Men can be tested for HPV, but routine testing is not widely available or recommended. HPV is a common virus that affects both men and women. It is linked to several types of cancer, including cervical cancer in women and anal, penile, and some head and neck cancers in men. Unlike women, who have established cervical cancer screening protocols, there is no approved or standardized HPV test for men in general clinical practice. Testing for HPV in men is typically limited to specific situations. For instance, men who have visible genital warts, which are caused by certain low-risk types of HPV, may undergo testing. Additionally, men who are at a higher risk for HPV-related cancers, such as men who have sex with men or those living with HIV, might have anal HPV testing performed in specialized healthcare settings. Furthermore, research studies or clinical trials may include HPV testing for men to better understand the virus and its connection to cancer risks. Currently, there is no Food and Drug Administration-approved HPV test for routine screening in men. This lack of standardization means that healthcare providers do not recommend HPV testing for men as a preventive measure. This is quite different from the established practices for cervical cancer screening in women. While HPV testing is crucial for preventing cervical cancer, it is less relevant for testicular cancer, which is not related to HPV. However, HPV does have links to other reproductive cancers in men, such as penile and anal cancers. This highlights the importance of HPV vaccination and awareness among men to help reduce their cancer risk. For men, practical measures include getting vaccinated against HPV. The vaccine is highly effective in preventing infections from the most common high-risk HPV types that can lead to cancer. Vaccination is recommended for males up to the age of 26, and in some cases, up to age 45. In addition to vaccination, using condoms and limiting the number of sexual partners can help lower the risk of HPV transmission. In summary, while men can be tested for HPV in certain clinical contexts, routine testing is not standard practice. The best approach for reducing the risk of HPV-related cancers in men is through vaccination and safe sexual practices. If you have concerns about HPV or related cancers, it is essential to consult with a healthcare professional for personalized advice and evaluation.